Today, we're diving back into a topic that has resonated with so many of our listeners: postural orthostatic tachycardia syndrome, also known as POTS. If you or a loved one has been struggling with dizziness, rapid heart rate, fatigue, or even brain fog, this episode is for you. We'll explore why POTS is often misdiagnosed, what treatment options exist, and most importantly, how you can take control of your health with the right support and resources. I'm so thrilled to welcome back Kelsey Botti, a physical therapist, POTS patient, and founder of the POTS Life app. Since we last spoke, the POTS Life has gained incredible momentum, helping people nationwide with a structured, research backed approach to managing POTS. Hi, Dr. Botai. Welcome back to the show. How are you doing today?
Good. I'm so glad to be back and be able to share a little more. So thanks for having me.
Of course, of course. So, I know a lot of listeners from our last episode were really interested in your approach. So, I'm really looking forward to diving into what's new. But first, for those who may have missed our first podcast, can you give a quick refresher on what POTS is and then why it's so often misdiagnosed?
Yeah, so POTS is confusing to say the least, which allows it to be misdiagnosed very often. When everybody stands, about 2 water bottles worth of blood go to our feet. In a normal body, that blood pumps up. Nobody thinks anything of it. Your body it does what it's supposed to, and you're able to move around, no symptoms. In a POTS body, I always say, if you could see me, it's like I'm using air quotes. It's the broken part. It stays, that blood pulls in your feet. And then, in order to not pass out because the blood is not coming up and moving as it should, you start to see adrenaline kick in and you see all the symptoms. You see high heart rate, GI symptoms, nausea, migraines, fatigue, joint pain. It's this wide spectrum of symptoms because that blood is not moving through your body as it should.